Good evening, I'm Sharon Taswell.
And I'm Sean Maroney. Thanks for joining us. New tonight, more effects from the closure of Franklin County's only emergency room.
Last night, we introduced you to Lewisburg's only doctor seeing nearly 75 patients a day. Tonight, CBS North Carolina's Amy Cutler examines the impacts of the county's EMS now forced to drive much further.
If you have an emergency here in Franklin County, it's Franklin County EMS that responds. But since there's no hospital in the county, they have to go outside the county. So instead of a call taking 30 to 45 minutes, each call can take upwards of 2 to 3 hours.
EMS 12 Central.
Tying up a lot of ambulances a lot longer than we normally would be.
Ronnie Wood is the logistics captain for Franklin County EMS. He deals with those challenges every day. That's why he says they try to keep the 8 ambulances they have on positioned throughout the county.
Time is a big thing in what we do.
It was back in October that Novant Health announced it was closing Franklin Medical Center. It gave its 140 employees and this community just 10 days notice. The county left without a hospital, without an emergency. Novant says they just couldn't create a sustainable model. Over the last 6 months, Lewisburg Mayor Pro Tem Boyd Sturgis says he's been working with the county, state, and federal government. His focus on the reopening of the emergency room.
The days of 70 or 80 bed hospitals in rural places just isn't very realistic anymore. If we can get a good freestanding emergency room with all of the bells and whistles, the diagnostics.
Wood telling us the closure is also costing taxpayers. It takes more gas to get to those other hospitals, and it's more wear and tear on the ambulances.
Yeah, an ambulance may run 1,000 miles, 1,000 or 1,200 miles a week. We used to run only 600 miles a week, so it's quite a bit of difference in mileage.
Franklin County EMS calls it frustrating, but they say that they're hoping that at the very least, the ER can still reopen. In Lewisburg, I'm Amy Cutler, CBS North Carolina.